Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is September 29, 2025. This video is on two articles on the global burden of cardiovascular disease. The first is open access in JACC, titled Global, Regional and National Burden of Cardiovascular Disease and Risk Factors in 204 Countries and Territories from 1990 to 2023. And the second is titled Global Burden of Cardiovascular Diseases Projections from 2025 to 2050, also available free in the European Journal of Preventive Cardiology, August 2025, published on 13 September 2025. The first article: cardiovascular disease remains the leading global cause of mortality and disability. Trends are shaped by risk factors, population growth, and aging. The Global Burden of Disease 2023 analyzed 375 diseases, including 18 cardiovascular diseases conditions and 28 risk factors across 204 countries from 1990 to 2023. Study cohort 6,447 with mortality non-fatal data source years, 55,565 risk factors source years, follow-up 33 years, all ages, both genders, statistics, Bayesian meta-regression, CODE-EM mortality models and decomposition analysis, demographics, results stratified by age, gender, and socio-demographic index or SDI. What did they find? 437 million disability-adjusted daily years in 2023, 1.4-fold versus 1990. 19.2 million deaths in 2023, increased from 13.1 million in 1990. 626 million prevalent cardiovascular disease cases in 2023, increased by 2x since 1990. 79.6% of the cardiovascular disease burden is due to modifiable risks: high systolic blood pressure, diet, high LDL cholesterol, and air pollution. Limitations of the study: variability in data quality across countries, uncertainty intervals wide in some regions, possible misclassification of causes. Key takeaways: cardiovascular disease burden greatest in low and middle SDI regions, that is socio-demographic index regions. Population aging and growth are the main drivers. Need for stronger risk factor control and public health strategies to meet WHO Sustainable Development Goal 3.4, which is to reduce premature non-communicable disease mortality by 1/3 by 2030. The next study was in European Journal of Preventive Cardiology. It's a projection of global burden of cardiovascular disease 2050. The cardiovascular disease is projected to remain the leading cause of death globally by 2050. Prediction helped policymakers plan interventions and resources. These projections are based on the Global Burden of Disease 2019 data, 1990 to 2019. Statistical model Poisson regression validated against ARIMA forecasting. Sample data from 204 countries across all ages, both genders. Measures crude and age standardized prevalence, death, disability adjusted life years or DALYs. Stratification by gender, 17 global burden disease super regions, example South Asia, Sub-Saharan Africa, and high income regions. Risk factors: metabolic, example high systolic blood pressure, fasting plasma glucose, body mass index. Behavioral, including diet, tobacco, physical inactivity, and alcohol. And environmental, air pollution and temperature. What did they find? Their projections found that crude prevalence nearly doubles from 0.98 million in 2025 to 1.14 billion in 2050. Crude deaths 20.5 million from 2025 to 35.6 million in 2050. a plus 73.4% increase. Age standardized mortality decreased by 30.5%, that is 218 per 100,000 to 115 per 100,000. Main drivers: ischemic heart disease, 20 million deaths, stroke, and hypertensive heart disease. Leading risk factors: high systolic blood pressure, 80 out of 100,000. Diet: high fasting plasma glucose, and high body mass index. Limitations: data quality inconsistent in low-income regions, possibly underestimation. Models assume linear trends, may miss shocks, example COVID-19, conflict, and climate change. It's limited to global burden of disease defined risk factors, excludes psychosocial, inflammatory, and pregnancy-related contributors. Key takeaways: population aging will drive crude cardiovascular disease surge despite prevention gains. Regional inequities: highest age standardized mortality in Central and Eastern Europe and Central Asia. Men are projected to bear higher mortality than women. There is an urgent need for region-specific and gender-specific interventions targeting high blood pressure, obesity, and dysglycemia. So, short comparison: the prevalence of the global burden of disease in 2023, 626 million cases. And projections is 1.14 billion, that's plus 82%. Deaths in 2023, 19.2 million. Deaths in projected in 2050, 35.6 million, plus 73.4%. The disability adjusted life years, 473 million in 2023, projected to increase by 54.7% in 2050. Age standardized mortality about 218 per 100,000 in 2023, reduced to 151 per 100,000, a 30.5% decrease. Insight: absolute numbers will soar due to aging and growth, but prevention and therapy are lowering risk at the individual level. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by Master MedFacts at mastermedfacts.com.